This is our COVID Roundup and CDC update for April 19th, 2024. Since last week, we're down about 14% in new hospital admissions due to COVID, and we're down about 9% in deaths due to COVID. Putting this into context, we've had about 9 straight weeks of hospitalization decreases from COVID, and we've had death decreases from COVID for 10 out of the past 12 weeks, with 2 weeks holding constant. I, however, do think it's time to treat the COVID hospitalization trends with a grain of salt, as we know that both Austin, Texas, and California have decided to stop reporting COVID hospitalizations. And we know that with the end of the public health emergency, the deadline was the end of April or earlier for being mandated to report to the CDC COVID hospitalizations. So, more scrutiny should be placed on that number, as it is likely to become more and more inaccurate over the next 2 weeks. Next, we have a similar alert to what we saw prior in regards to the travel monitoring program being delayed. This is because they opened 2 new processing centers, 2 new airports were included, and they are expanding the diseases that they are testing for, which is the problem we saw prior, where they're doing more with less. Which brings me to reemphasize my prior critique in that they should not be expanding this program outside of COVID monitoring unless they are given more resources in terms of funding and personnel, because by stretching the resources thinner and the personnel thinner, it makes it so that we have data processing delays and we have less up to date information for COVID. Moving on to our county level map of percentage change in new hospital admission compared to the prior week. As a reminder, anything that is orange is increasing levels of COVID hospitalizations. Anything that is yellow is holding stable. This could be stable at high or low levels. We have to look at prior maps to know. And anything that is green or teal is decreasing levels of COVID hospitalizations. Similar to last week, we are seeing lots of orange and yellow, which again is likely an indicator that things are turning around and heading right back up again. So this is the prior week's map. So there's again lots of yellow, lots of orange, and the current week's map. Moving over to our COVID-19 Iowa tracker, the top 5 states in terms of COVID viral activity are Minnesota, Missouri, West Virginia, Kansas, and Oklahoma. And while the CDC had not provided updates, Raj has. GN1 since the prior week dropped from about 25% down to about 23% of proportion. And KP2, the one that we are watching that is supposed to be highly immune evasive, increased from about 3.5 to 5.5%. So I still think that is the one to watch in terms of new emerging variants. But again, I think it's very important to realize that JN1 is only making up less than a quarter of all variants in proportion, and that it has many, many, many subvariants of JN1 at this point. Moving over to our New York State wastewater map, there were no updates for this week. The map was not updated whatsoever for the wastewater. And here's a blow up of that showing that the numbers have not changed and that the data was last updated April 11th, so last week. And finally, moving over to wastewater scan and our COVID wastewater levels, looking at California, we have been starting to see early activity of an increase with a pretty large increase in Stanford, Codiga, California, which is the name of the wastewater facility, Codiga, which is concerning because typically when we see a large spike in Codiga, like over here, it sort of precedes the imminent increase in a wave, at least in California. And when we look to all 194 reporting wastewater facilities to wastewater scan, we see a similar trend where we have started to see an increase in the wastewater signal, which is atypical for this time of year. This is one of those things where we're going to have to wait and see. It could stabilize and then remain low, relatively low until June, like it has typically. But this could also be the start of a spring wave that we have not seen before.